Slide 1. Welcome to the HIPAA overview training. The purpose of this training is to provide an overview of the Health Information Portability and Accountability Act, specifically concentrating on privacy and security. Slide 2. Now, the Health Insurance Portability and Accountability Act, otherwise known as HIPAA, passed in 1996. And Title I of HIPAA protects health insurance coverage for workers, their families, and when they change jobs. What we're focusing on is Title II of HIPAA, which are called the Administrative Simplification Provisions, and they required the establishment of national electronic healthcare transaction standards and also national identifiers. Slide 3. The administrative simplification provisions also require implementation of privacy security protections for health information. These are detailed in the HIPAA Privacy Rule and the HIPAA Security Rule. The provisions also included enforcement requirements and spelled out criminal and civil penalties for violations of the HIPAA laws. Now, the civil penalties have been significantly increased as part of what was called the HITECH Act, which passed in February of 2009. Fourth slide. Now, as far as the HIPAA Privacy Rule, it was considered one of the most sweeping healthcare privacy laws in the history of the United States, and it has since been amended by the HITECH Act again, which passed in February of 2009, which included new provisions around privacy of health information. Now, the object behind the privacy rule was to provide strong privacy protections without hindering access to quality health care. Now, healthcare organizations, which includes covered entities and business associates, must evaluate their privacy and security practices, identify gaps, and take steps to comply with the HIPAA privacy and security rules. Slide 5. Now, as far as the information covered, the privacy rule protects health information, otherwise known as protected health information, or PHI, that identifies an individual, is stored, used, or disclosed by covered entities and business associates, and includes information about the past, present, or future health and mental health condition of an individual. Slide 6. The HIPAA privacy rule covers electronic and non-electronic protected health information that are included in medical records, claims records, and related documentation, or data that's used to disclosed by covered entity or business associate in any form. And as an example, PHI includes stored electronic information, paper documents that include protected health information such as medical charts, oral conversations when discussing protected health information about an individual, microfiche and films. So in essence, anything that is or contains protected health information, no matter the form, is considered to be protected health information covered by the privacy rule. Slide 6. Now, the next concept is minimum necessary. The minimum necessary standard requires that the release of PHI be only that is required to get the job done for any disclosure or for internal working purposes. And that means that you cannot disclose protected health information for purposes that are not appropriate for that type of protected health information. It's keeping it to the minimum amount necessary to do the job. It can include the entire medical or claims record as long as it's justified. Now, where the minimum necessary standard does not apply is it does not apply to treatment. It does not apply to an authorization where an individual authorizes release of their own protected health information. It does not apply to certain government activities such as healthcare oversight. It does not include federal compliance investigations by, say, the Office for Civil Rights. Slide 8. Now, the Notice of Privacy Practices is the next concept we will be covering. Now, the Notice of Privacy Practices, the purpose behind that notice is to provide individuals information about not only their privacy rights, but how their protected health information will be used. It summarizes the covered entity's privacy practices, as well as addressing the protected health information, what it will be used for, what it can be disclosed for without the patient or the health plan member's specific authorization. and it also provides a covered entity's summary of current or planned uses of the disclosures of protected health information. Slide 9. Now, what are some of the mandatory requirements? If there are significant changes to the notice, then individuals must be notified. This does not mean that a notice has to be sent out to all individuals. It means that there needs to be notification in a newsletter, signposted in a waiting room, in a clinic, in a email to members, just indicating that significant changes have been made to the notice of privacy practices. If the covered entity maintains a website, the notice must be placed prominently on the website. That means it can't be buried. It needs to be easily accessible to anybody who is accessing their website. Now, with direct care providers, there's an added responsibility. New patients need to be not only provided with a copy of the Notice of Privacy Practices, but direct care providers need to request patients sign an acknowledgement of receipt of that Notice of Privacy Practices. Slide 10. Now, direct care providers, they also need to post that notice prominently in their office or their facility so individuals can see that notice. Now, health plans, they need to provide a copy of the notice to participating members when they enroll. Health plans also need to notify their members every 3 years of the availability of the notice. Again, this does not mean that the notice has to be mailed out to all individuals, but there needs to be a notification to the members that that notice is available upon request. Slide 11. Now, about the uses and disclosures of protected health information. Individuals need to understand what are those general rules regarding the use and disclosure of protected health information. And it's understanding that, as an example, protected health information can be released for the purposes of treatment, payment, and healthcare operations without specific authorization from the individual. They need to understand the disclosures where there are allowances for other purposes where authorization is not required. And need to understand where an authorization is required. Examples of areas where an authorization will not be required would be for like public health, healthcare oversight activities. That would be, as an example, a public health plan or a Medicaid plan that is being audited by a healthcare oversight agency. Slide 12. Now, in treatment, payment, and healthcare operations, generally that information can be released or disclosed without the specific authorization from the individual for purposes of, again, treatment, payment, and healthcare operations. Now, authorization for treatment, payment, and healthcare operations may be required by state privacy laws or other federal laws, such as 42 CFR Part 2, which is specific to alcohol and chemical dependency. Many states have laws that specially protect information such as mental health, HIV/AIDS, and so forth. And in those cases, even for treatment, payment, and healthcare operations, there may be a requirement to obtain the authorization of the individual, and that's being necessary to be aware of what the state laws require. Slide 13. Now, areas where no authorization is required. These are some of the exceptions that are included in the HIPAA privacy rule. Covered entities may use and disclose protected health information without authorization for certain activities, and remembering that you still need to pay attention to what state laws are and what some of the federal law exceptions are, such as 42 CFR Part 2. The data or information can be released for certain law enforcement activities. This does not mean that a law enforcement agency has the right to view or access any protected health information. It needs to be for specific activities such as warrants. In some states, if an individual shows up in the emergency room with a gunshot or a knife wound, that has to be reported to law enforcement. For public health activities, such as vaccinations, HIV/AIDS tests, and so forth. For healthcare oversight. And healthcare oversight, again, is you have healthcare oversight agencies that oversee the management of Medicare, Medicaid, and related government plans. So it's oversight of those agencies in the event of, say, an audit. Also, it's reporting suspected abuse, neglect, or domestic violence. Now, there is a provision in HIPAA that indicates that if, say, it's an adult and there is suspected abuse that is being reported, that unless it will cause harm to that individual to tell them, the victim is required to be notified immediately following reporting the abuse. PHI can also be released for certain judicial and administrative proceedings. An example of administrative proceedings would be as somebody applying for Social Security benefits, for disability benefits, information would be released for administrative purposes and would not necessarily require the authorization of the individual. Slide